Hello, my name is Dr. Rafi Romano. Today, in my second movie on the Invisalign technique, I want to share with you case presentations done by myself in the last years in different kind of problems. Let's start first from crowding, from simple crowding to more complex crowding. As you can see here, this case has lower crowding, lower incisor crowding with overlap and rotation. This is the overjet we had. We didn't have a lot of overjet, so we couldn't do here a lot of proclination in order to solve this problem. We have done here, you can see here an arrow on the overjet. And we have done here stripping, which is very, very moderate. As you can see, we had 0.2 in only three places. The reason is that when you do rotation, you can decide that you are not proclining the teeth, but you do the rotation to the outer bow of the most prominent tooth, and this is what we have done here. So as you can see, this is the before, and this is the plan we had with a clean check with the Invisalign. We had 25 aligners, which is around 1 year. We did it on that time very slow. It was in the beginning around 13 years ago. And you can see here the patient with the Invisalign. We had only few attachments. One of them is like an elliptic attachments. One of them is elongated. And you can see how nicely it fit on the teeth during the treatment. You can see here at the end of treatment, you can see midline is okay, everything is aligned. The posterior bite stayed the same because we have asked for no changes in the posterior bite. And you can see that the overjet definitely did not increase, although that we have unraveled the crowding. And this is a case when we did this transparent permanent splint in the lower incisors, cuspid to cuspid. This is before and this is after. That's another case of crowding that includes also a torque problem of the lower left cuspid. You can see that the lower left cuspid is blocked in, and as you can imagine, the root is buccally inclined. So we had to move the tooth not only just to throw it buccally, but also slowly torque the root with the Invisalign. And you can see the plan. This is the clinical picture versus the computerized one. And this is what we have planned to do. You can see very slow movement, not any stripping involved, just slowly pushing this tooth out. This was done very slowly. Even today, some cases I divide to many aligners, not to be in a competition who will finish the case first, but to get a really predictable and good result. And this is the patient with the aligners in the mouth, and this is the case when it was finished. I follow up this case already for 15 years and everything is stable without any retention wire, only with some retention vacuum retainer plate that she's wearing every night. And this is a case at finish. You can see also the shape of the papilla and the gingiva in the area of this tooth that was blocked inside. Very healthy and very nicely built. Let's look now on root upright. Root upright is one of the probably most tough movement in orthodontics. Many people claim that Invisalign or other clear aligners are not capable to do it. So you can see here a case I've done also many years ago. You can see the inclination of the upper left central incisor when the root is angulated and the crown is angulated. We have also open bite tendency. You can see here the plan. On that time, I didn't do attachments on the front teeth. We just planned slowly, grabbing the tooth inside the aligners and uprighting it. Today, I guess I would have done some attachment on this central, because today the attachments that Invisalign has developed are amazing to do such movements. And here you can see the case at finish. You can see the upright of the root. You can see how the long axis of the left lateral incisor, left central incisor is parallel to the right one. And you can see the comparison between the before and after. Let's talk a little bit about spaces. Everybody knows that we can close spaces with Invisalign. Some people even say that it's very easy. We just need to push the teeth inside and we close the spaces. So have a look at this case where the space was almost in a tooth size and the overjet was very minimal. And you can see there is lack of papilla. We have no papilla because of this space. And you can imagine that this patient was not as young as we all are. She was around 65 years old with some periodontal problem. So we plan to do this space closure again very slowly, very carefully. I sometimes even tell the patient to wear the aligners 3 weeks and not 2 weeks, just to be on the safe side. There is minimal interproximal stripping in the lower incisors to enable more overjet so we can have a nice result. You can see the patient after almost 1.5 years with the aligners. You can see the gingiva very healthy, very pink. You can see how the aligner fit the teeth perfectly. And you can see the case before and after and how healthy it looks, not only how aesthetic it looks. And this case is also very stable. I follow up this patient already for the last 13 years without any problem. That's a case I've just recently finished. This guy is 70 years old with a very difficult case, very compromised periodontal situation, very minimal bone support, spacing, and to add to this problem, he has also class 3 malocclusion, which means crossbite, anterior crossbite, and proclination of these lower incisors because of the periodontal problem. We plan to do a very slow movement. This case has gone 2 years of treatment, which means around 50 aligners. Very slow, very carefully, all the time doing consultation with the periodontist. Here is a case before, here is a case during the treatment. You can see that the patient is wearing the aligners and the spaces that he still has are kind of masked by this transparent aligner. And you can see the case at the end, just 2 weeks ago. You can see the overjet we got. You can see the color of the gingiva. You have to trust me that the teeth are very stable. They are not mobile. The periodontist watched the periodontium all the time, and he said that he almost never saw such improvement around teeth, compromised periodontal teeth in orthodontic treatment. And Invisalign give you an advantage over other techniques because the aligner actually embrace the tooth from the front, from the back, and from the sides, and therefore you have no trauma, you have no jiggling, and versus braces where the tooth has the possibility to jiggle with the wire and with the occlusion. Here, every time the patient bites, the aligner actually hold the teeth and protect them, and therefore there is chance for the periodontium to build itself and to recover from the previous periodontal disease that this patient had. You can see the occlusion very nicely after around 2 years of treatment, very good cleaning, hygienist treatment every month. And this is a case just filmed recently around 2 weeks ago. Extraction. There is, of course, different types of extraction. This case was done also in the last few months by me. You can see here a minor crowding in the upper arch and a very severe crowding in the lower arch. And we had to do some treatment decisions here. We have decided to do upper interproximal reduction and lower central or lateral incisor extraction. So the advantage of Invisalign in such cases is that you can actually use the aligner to put inside the place where you want to extract the tooth. You can put some composite that will fill the gap, so when the patient is wearing the aligner, you can almost avoid seeing that something has happened. So you can see here the plan that we did: extraction, the right lateral incisor, and then aligning the teeth, taking the cuspid, which was in a crossbite, taking it back. And you can see here during the treatment, here you can see the extraction, and this is after around 3 months, and this is around 6 months. The space is almost gone, and you can see the attachments we had in order to make sure that the roots are going parallel and not tilting towards the extraction area. And you can see here, still in treatment, and over here, the case is not finished yet, but you can see already how the alignment of the lower teeth is very nice. Aesthetically, we get a very, very nice result. Patient is very happy, and this is only 6 months of treatment. That's another case where we have decided to do 2 extractions, 2 premolar, upper premolar, second premolar. And many people ask, okay, you know, when you do extraction, especially in adults, second premolar, where we will get the anchorage, how we can make sure that we will close all the overjet and all the posterior segment will stay the same. Well, Invisalign provide you with such a great, good anchorage and a very precise movement, of course, as long as you have planned it carefully and slowly. I don't like to do these cases fast because I don't like to fail. I don't want to show that I can do things great in no time. I want to have great results because this is how you are judged by your patients. So this is a plan we have done. You can see movement of the front teeth back and expanding a little bit the posterior in order to get a very nice occlusion. So you can see here another view of the clean check, what we have planned. We have done also some movement from the posterior to the front because this is a medium anchorage case. And you can see here at the end of treatment, it's again around 16, 17 months of treatment. You can see very nice occlusion, very nice alignment, and you can hardly see that this case had 2 premolar extractions. Distalizations. Sometimes I use Invisalign in order to distalize molar, not many times, and only when I think that this is a great advantage. But if you want to, you can see, for example, this case where the cuspid, the upper left cuspid was buccally inclined and there was crossbite in the back. We have decided to do 1 by 1, distalize the 7, the 6, the 5, the 4, and then put the cuspid inside. And here you can see the patient with the Invisalign in the mouth, and then slowly you can see a comparison between the clinical situation and the clean check. And you can see after some times the case look clinically and virtually the same. We have distalized 7, 6, 5, and 4, and you can see the same situation in the right and left screens. And this is the case when we put the cuspid back in the arch. And again, the case look the same between the virtual and the computerized plan. This is before and this is after. Asymmetry. Invisalign can be used for any malocclusion. The only question that I ask myself, since I'm doing a lot of braces, I'm doing a lot of lingual orthodontics, is first of all the patient management, which is different with clear aligners versus braces. But the second is if it's going to be the same task, if it's going to be the same results. And when I think it is, I definitely recommend Invisalign, like in this case. This case had some asymmetry problem. You see the midline is off. There is also some deviation of the mandible. You can see double crossbite in the left lateral incisors and also in the molar area. And we have planned here to do stripping, interproximal reduction in the lower incisors, retracting them back and move the mandible back to its place. Of course, not aligning completely the midline because it was impossible due to the skeletal deviation. But you can see here the patient with the aligners, with some attachments, and you can see the occlusion we got. We solved the double crossbite. We got a very nice alignment and a very good and stable occlusion. This is the upper and lower maxilla and mandible. And I want to conclude this case presentation with smile design. I think one of the greatest tasks we have in orthodontics is to improve the smile design, and not only when teeth are crowded, not only when we have spaces or when teeth are proclined. As you can see here, this case came to me after she did orthodontic treatment. She was not happy, although that you can see a very nice alignment, a very good occlusion. But something is wrong here. And you can see that the teeth were proclined, and in a way that when you look at them at the front, you can see actually very short teeth and very big shadow of the light that come to the teeth because of this proclination. So by simple planning, understanding what is the size of the teeth, and can I do some reshaping, not only stripping, not just reduce enamel, but actually reshape the tooth, improve the ratio between the length and the width to be more proportional. If you plan it properly, and if you do a nice simulation with a clean check in order to understand what is the occlusion we're going to get, how much we need to strip, then you can end in a very short time. This is around 5-month treatment, a little stripping, a little delicate touch, and you can see how the before looks versus the after. Much more attractive, the teeth are more straight, and the light falls on the smile in a more pleasant way, more appealing way, and you can see the smile that she had after the treatment. Invisalign, in conclusion, is a great tool to do 3D control, to have aesthetic treatment, very easy for the patients and doctors because most of the work is done by the doctor in the planning stage and not in the mouth, and it is very stable, aesthetic, and predictable results. Thank you very much, and I'll be happy to see you in my next series of lectures.